Hello guys, so now we shall be discussing some other gyri and sulci that are present on the superolateral surface of your cerebral hemisphere, right? So I hope all of you know what is the superolateral surface, right? For example, if this is your cerebral hemisphere like this is your cerebral hemisphere, right? So this is the right half, this is the left half of the cerebral hemisphere. So whatever you can see on the outer surface, right? All this outer surface is called as the superolateral surface. Now when I am dividing the cerebral hemispheres and when I am showing it to you the medial surface, this is called as the medial surface of the cerebral hemisphere. So this surface is called as the superolateral. So there are some other structures which we have to discuss regarding this gyri as well as sulci on the superolateral surface of the cerebral hemisphere. So let us see what are those structures right now. Okay. So first of all, let us make a picture of the cerebral hemispheres from the superolateral surface. Right. So this is just a rough picture of the cerebral hemispheres on the superolateral surface. Now here I have already told you that on the lateral side like this we have got a fissure called as Sylvian fissure, which is also called as lateral sulcus. This in my previous lectures I have talked about this in detail. Okay. So in the in the video of external features of cerebral hemispheres, there I have discussed this. And in this lateral sulcus or Sylvian fissure, I told you that there are three rami. Okay, what are the three different rami? One ramus is projected anteriorly, so this is called as anterior horizontal rami. One rami is projected upwards, it is called as ascending rami, right? And the other rami is going back, that is called as a posterior rami. So there are three rami like this, see here. So this is one ramus, and after that one which is going up is an ascending ramus, and after that one which is going on to the back like this is called as a posterior ramus. This is called as a posterior ramus. So just let us write down these names. So this one over here is called as your posterior ramus. Posterior ramus of which sulcus? Lateral sulcus. And this one is called as a anterior ascending ramus. Anterior ascending ramus. Okay, anterior ascending ramus. And next we have got something called as horizontal also. So this is called as anterior horizontal ramus. Okay, anterior ascending ramus, anterior horizontal ramus, as well as a posterior ramus. So these are the rami or which are located on the lateral sulcus, or we can also call it as Sylvian fissure, right? So lateral sulcus or Sylvian fissure. Lateral sulcus or you can also call it as a Sylvian fissure, right? Now here what I'm going to do is that within this posterior ramus you have got two structures. Okay, so what are the structures that are located in the posterior ramus? See, this is one structure over here and this is another structure over here. So this structure which you can see, this is called as the anterior wall, and the upper one is called as the upper wall. So in the lateral sulcus, in the posterior ramus of the lateral sulcus, we have got two walls. So this wall over here, whatever you see, is called as the upper wall, and this wall over here, whatever you see, is called as the lower wall. Now what I will do is that I will stretch these two valves, okay, the upper wall as well as the lower valve. So when I stretch this upper wall and lower wall, so when I stretch and open it, inside you can find some more structures. For example, as you can see here, what this guy has done over here, you see, with the help of these retractors, he has stretched one above and he has stretched the lower wall below. After stretching the upper wall above and lower wall below, right, you can see some structures inside. So now we shall see what are these structures. So another clear picture here. See, upper wall is stretched above, lower wall is stretched below, and after stretching you can see some structures inside. So let us see what are the structures that are located inside here, right? So now let us draw the same picture again and see what will happen when these structures are stretched out. Okay, so let us say this is the surface right? Now here, as I have already discussed, that here you have got, this is anterior horizontal. Next we have got the anterior ascending part, right? And I have stretched the two walls, right? See, I have stretched one wall. This is the upper wall which I have stretched back, right? And after that I have also stretched the lower wall downward like this. Upper wall upward and lower wall downward, right? So when I have stretched them back like that, inside here I will find a specific structure. This is called as the floor. Okay, for example, let us say this is in this way. This is the lower wall, right? So that is the upper wall, this is the lower wall. Actually the lower wall is a little bit wavy in this pattern like this. Okay, now if you very clearly see, again, even if you did not understand this, I'll also show you a paper model where you will very clearly understand whatever I'm speaking here. Okay, so just pay patience and listen to whatever I'm telling you. So this wall over here which I have drawn here, this is called as your upper wall, and this wall down which I'm drawing right now is called as your lower wall. So when I have stretched down the upper wall and the lower wall, inside I find one important structure. See this structure, this white color part over here is called as the floor. What is this? This is called as the floor of what? Posterior ramus of the lateral sulcus. Okay, so that is the floor of the posterior ramus of the lateral sulcus. Okay, so these are the structures over here. Now, another important thing you need to understand here is that here we know that in this supralateral surface, here we have got one very important structure here, and here also we have got a very important structure. So we have got two important structures over here. What are these two important structures? This structure over here is called as superior temporal sulcus or gyri. See, this one over here is called as superior temporal sulcus. Okay, and this structure over here is called as inferior temporal sulcus. One is superior, another one is inferior temporal sulcus. Temporal sulcus. So there are two sulci and there are three gyri, right? So what are these three gyri? See this gyri, this green color shading, whatever I'm doing here, right? So this gyrus is called as superior temporal gyrus. And after that, this yellow color one is called as the middle temporal gyrus. One is called superior temporal gyrus, another one is called as the middle temporal gyrus, and the last one, this one is called as the inferior temporal gyrus. So we have got three temporal gyrus over here. So what are these three? So this one over here is called as a superior temporal gyrus. Okay, and this one over here is called as the middle temporal gyrus, and the last one, this is called as the inferior temporal gyrus. So superior temporal gyrus, middle temporal gyrus, as well as inferior temporal gyrus. Now if you look at this superior temporal gyrus, whatever this green color thing which you are looking here, actually this is called as the lateral surface of superior temporal gyrus. Now this is where it gets tricky, it gets confused, but nothing to worry. So this is called as a lateral surface. Okay, so whatever surface I have shown you here, this surface is called as a lateral surface of superior temporal gyrus. Okay, and you can also see this part. I told you this is called as a lower part. Yes or no? This is called as a lower wall of what sulcus? Lateral sulcus, or you can also call it as a lower wall of posterior ramus of the lateral sulcus. Now this lower wall is also called as superior temporal gyrus, but that is not called as a lateral wall, that is called as a superior wall. Now I know it is very difficult for you because these terminologies are very tricky and you are not at all understanding this. I told you again, I will show you a paper model, there you will understand it clearly. So this one is also called as a superior temporal gyrus, and this superior temporal gyrus is of which surface then? This time it is which surface? This time it is called as a superior surface. Superior surface. So we have got two surfaces of the superior temporal gyrus. One surface you called as a lateral surface, another surface you called as a superior surface. For example, this is how the superior temporal gyrus is. You see here we have got superior temporal gyrus and this is also superior temporal gyrus. Now this part of superior temporal gyrus, this one is called as the lateral surface, right? Now just above the lateral surface, this one is called as the superior surface. Yes or no? This is lateral because it is laterally projected. This is on the top, so this is called as the superior surface. So one we have got the lateral surface of superior temporal gyrus, we have got the superior surface of the superior temporal gyrus. Okay. Now if you very clearly see here on the superior surface of superior temporal gyrus, you have got some very important structures. See here. You see these are some very important structures that are located like this. Okay. So what are these important structures? Now from these important structures, first of all, what are coming out? See, from these important structures you see some bumpy elevations are coming out, and these bumpy elevations are horizontal or vertical? They are horizontal. Can I also call these bumpy elevations as transverse? Right? So these are called as transverse temporal gyrus. Okay. So these bumpy elevations over here are called as transverse temporal gyrus. Okay, so these bumpy elevations over here are called as transverse temporal gyrus. How many transverse temporal gyruses we have got? We have got 3. See, this is 1, this is 2, and this is 3. How many we have got? We have got 3 transverse temporal gyrus. So what is this one? This one is looking forward. So can I call this one as anterior? And the 3 number is looking backward. So can I call it as a posterior? Right? So we have got 3 transverse temporal gyrus. One is called as the anterior, another one is called as the middle, another one is called as a posterior. Okay, anterior transverse temporal gyrus, middle transverse temporal gyrus, and posterior transverse temporal gyrus. Now out of all this, which is really important to you is the anterior one. Why anterior one is really important to you? Because anterior one is the one which is having auditory cortex. Okay, the anterior transverse temporal gyrus is the one which is having auditory center. Okay, so this is the one which is mainly having this auditory center. So that is the reason why this is very, very important. Okay, now where are all these transverse temporal gyrus located? Tell me. All these transverse temporal gyrus are located on the, what is this? Superior surface of superficial superior temporal gyrus. Okay, so where are these anterior, middle, and posterior transverse temporal gyri located? All these transverse temporal gyri, they are located on the superior surface of superior temporal gyrus. Okay, where are they located? They are all located on the superior surface of superior temporal gyrus. So as I already told you, we have got 3 superior temporal gyrus. One you call it as an anterior, middle, as well as a posterior, right? Now, okay, even if you did not understand this, again I will come back to this after showing you a paper model. But before I show that model, one very important thing I want to know is that this area which I am about to highlight with this yellow, right? So this area, whatever you can see, I told you that this is called as the floor. Floor of what? This is called as a floor of the posterior ramus of the lateral sulcus. Posterior ramus of lateral sulcus. Now this floor is having a very important structure over here. If you can see, this floor is having a very important structure which I am highlighting with the red color like this. So this structure, whatever I have drawn here, is called as an insula. What is this called as? This structure over here is called as insula. This structure over here is called as insula. Now within this insula there is a sulcus that is present vertically down like this, and this sulcus is very straight and present exactly in the center, right? So this is the sulcus that is present in the insula, in the center of the insula. So I have to call this as sulcus centralis insulae. Sulcus centralis insulae. So this structure which is exactly present in this sulcus, which is exactly present in the center of insula, is called as sulcus centralis insulae. Now this sulcus centralis insulae has divided the insula into 2 portions. Now look at the portion number 1. In portion number 1, you have got some structures like this. These are called as gyri. In portion number 2, also you have got a gyri like this. Now tell me, portion number 1 gyri are small or portion number 2 gyri are small? Portion number 1 gyri are small. So that is the reason why these group of gyri which are very small are called as gyri brevis. Okay, these are called as gyri brevis. So portion number 1, these gyri are called as gyri brevis. Okay, in the same way, you have got in the portion number 2, you have got this long gyri, right? So let me name this where there is no space over here. So let me name it like this. Okay, in portion number 2 also, these gyri, whatever you can see here, this is called as gyrus longus. So if there is gyrus brevis which are small, the long one should be called as gyrus longus. This is called as gyrus longus. Okay, so two important things, one is called as gyrus brevis, another one is called as gyrus longus, and this center one is called as your insula. Okay, and the line in the center is called as sulcus centralis insulae. Clear? So what did we discuss right now, guys? So we have discussed a few important things that we told you that, okay, let me show you the model over here. Right, if you can see this cortex over here, right? Now in this cortex, you see this is the frontal region, right? And remember that in the previous lectures I've discussed about the poles. In that poles I told you, see, this pole is called as a frontal pole, this pole is called as a temporal pole, and this pole over here is called as a occipital pole. Now this is your frontal side, this is on the back. Now you can see a sulcus in the center. What is the name of this sulcus? This is called as lateral sulcus, and exactly speaking, this is called as the posterior ramus of the lateral sulcus, right? Now what I am doing, I am catching hold of there are two parts. This is called as the upper wall and this one is called as the lower wall. Okay, now upper wall I have kept a spatula and lower wall I have kept a retractor like this, and now what I am doing is that I am just separating the upper wall from the lower wall. Now when I separate the upper wall from the lower wall, and remember one thing, before I separate, one thing you have to know, that exactly where my finger is, okay, exactly where my finger is, exactly at this position, this is the superior temporal gyrus, right? You can look even in the picture that this is your superior temporal gyrus, this is your middle temporal gyrus, and this is your inferior temporal gyrus. Now this is your superior temporal gyrus. Now what I am doing, I am pulling it down like this. I'm pulling the upper wall up, the lower wall down. Now when I'm pulling it like this, this one is still the superior temporal gyrus, but this surface is facing towards you. So can I call this superior temporal gyrus as the lateral surface of superior temporal gyrus? In the same way, if you see this one, right, this roof, this is called as a top surface, right? So this is also superior temporal gyrus. Now this superior temporal gyrus, this is called as the superior surface, this is called as a lateral surface. This is what I told you, right? So I told you like this. So this structure is called as a lateral surface, and on the top you have got the superior surface. So in the same way here also. So this is called as the lateral surface of superior temporal gyrus. This is the superior surface of the superior temporal gyrus. Okay. Now on the superior surface, if you can see here, on the superior surface, you can see three important things. What are these three important things? These are called as gyri. What are these gyri? These gyri are transverse, right? So these are called as transverse temporal gyrus. So if I ask you how many transverse temporal gyrus are there, what will you tell? 3. What are those 3? This is called as anterior, this is called as a middle, this is called as a posterior. So anterior transverse temporal gyrus, middle transverse temporal gyrus, posterior transverse temporal gyrus. Second question, if I ask you where are these transverse temporal gyrus, what will you tell? They are located on the superior surface or on the lateral surface. They are located on the superior surface of the superior temporal gyrus. Okay. Now deep inside, when I'm completely pulling the upper wall upward, lower wall downward like this, you can see this structure which is deep inside, right? This structure which is completely deep inside. Now what is this structure which you can see? This red color one is called as a insula. Now this insula is divided into two portions with the help of a sulcus called as central sulcus of the insula. Now on one side you see this small gyri here, these small gyri are called as gyrus brevis. You can also see a large gyri over here, this large gyrus is called as gyrus longus. Okay, and this sulcus is called as sulcus centralis, and this entire red color thing is called as what? This is called as insula. So this is the thing which I have just spoke here, right? So these are some of the structures which you need to know. These are some of the structures which you need to know regarding the insula. Okay, so these are the structures that are buried within the lateral sulcus. Exactly speaking, these are the structures that are buried within the posterior ramus of the lateral sulcus. Okay, so the topic is structures that are located within the posterior ramus of the lateral sulcus or on the floor of the lateral sulcus. Okay, so this is all you need to know. Thank you so much for watching my video. Goodbye.